Community Health Workers Training. Today's topic is Diabetes 101. My name is Caroline Blanco, Registered Dietitian and Director of Program Development and Collaborations here at the ADA, and I'm your host for today's CHW training. So if you go to the next slide. Please note that the information provided in this presentation is not meant to medically treat or diagnose individuals with diabetes. If individuals have any questions related to their medical condition, they should consult with their healthcare provider. All content on today's training has been reviewed to ensure balance and adherence to the ADA standards of medical care in diabetes. Go to the next slide. So I'm thrilled to introduce our expert presenter with us today. Valeria Mallett is a registered dietitian and certified diabetes educator, diabetes care and education specialist with a bachelor's degree in health sciences from Rutgers University. Born and raised in Brazil, Valeria knew her passion for food and nutrition at an early age. Valeria was appointed the leader of the Association of Diabetes and Education Specialists, the Oregon chapter, where she is active on various committees. And as a former trainer of the ADA's What Can I Eat program, Valeria was selected to be a state representative and coordinate a program at a federally funded healthcare organization. Valeria continues to offer care to underserved populations and serves as an advocate for prevention and management of diabetes, in addition to diseases associated with obesity. Valeria serves as a clinical dietetic preceptor to interns across the country, and in 2020, she received the Diabetes and Education Specialist of Oregon Award. As the founder of Valeria Mallett Nutrition, patients are welcome to a judgment-free zone that honors cultural diversity. Her group practice offers nutrition services and workshops for patients, caregivers, and loved ones wanting to learn more about diabetes management and healthy eating. So we're so excited to have Valeria presenting today. So I'll go ahead and turn it over to her.
Hi, everybody. Thank you so much for the introduction. Caroline, appreciate it. And I'm so excited to meet with you all today. I know that you guys are do a great work out there for all people with diabetes and other conditions. So I'm thrilled to be able to speak with you today. Before we begin, Caroline, would that be okay if you actually share your screen? Would that be okay? I know that we had a change of plan right now, but would that be okay from your end, Caroline?
Sure, just give me a minute.
Okay. While we wait, I want to ask here, how many of you feel confident to work with people with diabetes? Can you raise your hand? Does everybody has a, do you know how to raise your hand here at Zoom, on Zoom?
Yeah. Yes, so far there's about 45 participants raising their hand.
Awesome, great. Yeah, thank you so much for showing me that. Well, first, thank you again for serving these people with diabetes. You know, it's such a great, I've been working with diabetes for the past 6 years, and I'm in love. I don't have diabetes myself, but I love to work with people with diabetes because it's one of those things that we're going to learn about today, different types of diabetes and different ways to manage. So I'm excited to be here with you today to discuss that. So the learning objectives for today, we're going to talk about the difference between type 1 and type 2 diabetes and also pre-diabetes. We're going to discuss the importance of controlling blood sugar through lifestyle changes and physical activity. We talk a lot about today this one thing, right? Can we cure diabetes? Can we manage diabetes? There is all these buzzwords. So we're going to talk about that, how important it is to manage or control our blood sugar through lifestyle. Also, we're going to explain the roles of community health workers and what the roles that you guys have around diabetes management. And the thing that we definitely all need to focus on is diabetes prevention. Next slide. So I have no disclosures. I have a private practice, but no other disclosures. Okay, so valuable role of community health workers in diabetes care. First of all, I have to say that I have worked directly with community health workers throughout my career, and I truly appreciate what you guys do every day. But one of the values that you guys bring, you're trusted, the frontline health worker, and you guys do really have that practical education and guiding people to build self-management skills. So I hope that you guys all know the value that you bring to every single person, I guess, with diabetes. And community health worker work across, right, clinical settings and community, and it's just part of this interdisciplinary team, right? Work in different settings like clinical and homes visits, faith-based support groups. One of the things that I used to work in migrant health centers, farm workers, right? Also WIC, which is women's, infants and children. And also we may find community health workers in food banks and food pantry. I would like to, if you can, you can read now, but raise your hand if you know somebody who has diabetes. It can be a family member, it can be a neighbor, it can be a colleague of yours. It's likely that you know somebody, right? Because 1 in 10 Americans today have diabetes. And this is an alarming number, right? According to the CDC, the Central Disease Control and Prevention. And it's something that we all need to work together. We all need to come together as a community, as experts, as community health workers to educate, to bring awareness of how do we bring that prevalence down? How do we bring that number down, right? We know that diabetes is a public health crisis right now, right? We know that there are some groups of people that have more incidence of diabetes. When we talk about Hispanics, we talk about Blacks, right? Asians, they are genetic changes there, lifestyle. So it's important that we talk about, gosh, this is a problem, and this is how we're gonna work together to come up with a solution to prevent diabetes. So who is American Diabetes Association? This sets us apart from all other organizations, right? So American Diabetes Association bring everybody together. And it's an organization that really thrives to bring knowledge, to bring prevention. We think about cures, we talk about therapies, there's guidelines. This is a really association that comes together to bring knowledge to the public. It is a place that we get credibility, we get good information, right? Because there's so many information out there. If you go on Google, if you go on YouTube, there's so much, as I shared in the beginning, curing diabetes, or this tea for diabetes, or there's always something there. We all want to work together to figure out, is there something we can do? But also, is there something that is studied, right? Is a guideline? Was this recommendation really accurate? So that's kind of what the American Diabetes come together. And American Diabetes every year comes with the Standards of Medical Care in Diabetes, which is a publication that every single one of you have that resource right now. You can just Google it. Actually, you can go to the American Diabetes website and just look it up. You have it really breaks down of what is the guideline for people who have gestational diabetes or the type 1 diabetes, what we do in a hospital setting. What do we think about nutrition? What is really the top recommendation for when it comes to nutrition and diabetes? So I'll encourage you, if you have not got a chance to review the newest standards of care, I would recommend you go in there and check it out. You can download, you can also order the book, and it's completely free. So it's a comprehensive approach when we're talking about diabetes. So the American Diabetes Association vision, it is to prevent and cure diabetes and to improve the life of all people affected by diabetes. So we're talking about prevention, we talk about cure, and we also talk about improvements of our life, okay? The comprehension approach, American Diabetes Association are the leader across multiple areas. Like I said, in research, when we're talking about what are the guidelines, advocacy, we're also looking at changing policies around affordability of medications, thinking about programs, also outreach, right? Like what are the information out there for people to get, as well as healthcare provider and education training, because it's not only about getting the information, but also do providers know exactly what is the most innovative research and what is really the newest guidelines, because they change every year. So what is prediabetes and diabetes? Who here, I'm curious, who here feels comfortable to really describe the difference between type prediabetes and diabetes? Just raise your hand. So how many raised hands? I cannot see my end.
So far, there were 29.
29. Okay. Okay. So good. Some of you know the difference and what it is. And if you don't, then hey, you're in the right place. You're in the right place right now, because we're going to talk about that. Prediabetes is when your blood sugar levels are high, but they're not as high so that it is not a diagnosis for diabetes. So the thing is about prediabetes, many people out there, they're walking around right now and they may have prediabetes, but they don't have any symptoms. They don't know. They don't really know. So again, prediabetes, like, there's something boiling there, but we quite don't know yet what it is. Right now, the CDC shows that 88 million of people here in the US, adults, have prediabetes. And this number is huge. Why? Is because we know now by research that a lot of these people eventually may develop type 2 diabetes. And that's why we nowadays talk more about prediabetes, because we know the importance of tackling that prediabetes so that we can be proactive in preventing type 2 diabetes. And here also you see 85% of Americans with prediabetes don't know that they have. And this is really cool, because when you look at the research, they also talk about men not knowing, and that has to do with about men not going to the doctor as much. But it's so important that we get checked. We get checked to see if we have that prediabetes. Prediabetes, as I mentioned, can lead to type 2 diabetes. And this is such an important thing that every single one, if you don't remember anything I say today, please remember this. It is so important that we tackle prediabetes, because we know type 2 diabetes is a preventable chronic condition that can lead to a lot of complications when not well managed. Right? So things like heart disease and stroke. So every single one of you here today have the ability to bring awareness of how important it is from us to educate. And when we see somebody with prediabetes, we tackle that, because we don't want that to turn into type 2 diabetes. You can learn more on diabetes.org risk test. And this is an amazing resource that you can actually print it out for your patients, where you ask, there's a series of questions to see if you are at risk of prediabetes, and also steps to lower your risk for diabetes. So, okay, so now we know prediabetes is when you have sugar in your blood that is a little bit high, but not as high to be type 2 diabetes or type 1 diabetes. So what is diabetes then? Well, diabetes, there are many types of diabetes. We know that diabetes is when the body says, okay, look, there's a lot going on here and I cannot handle this amount of sugar in the blood. So that is when we call diabetes. Now, there are many types of diabetes. There's type 1 diabetes, there is type 2 diabetes, there are gestation diabetes. There's also one that is not mentioned here, but another one is called LADA, which is the latent autoimmune diabetes in adults, which can happen for some people who have a thyroid problem. But it's something for us to be aware that when we're talking about diabetes, not just one type. Okay, so I wanted to share, I really requested this picture because I think it's so important for us to think about, okay, how is food, what food has to do with all of this, right? And as you can see over here, there's an apple and there's things that contain carbohydrates. Is a food group, right? Things like your bread, your fruits, your milk, things like that. That type of food, they are high in carbohydrates, which then converts into sugar into the bloodstream. And so how does that happen? As you can see, there's an apple being eaten there. It goes from our mouth, go down to our stomach, and right there in the stomach, our food breaks down, and then our food breaks down and then goes into the intestines. So in the intestines, that's when our blood sugar, our glucose, all that sugars from the fruits, it can be a natural sugar or an added sugar, that's when it's absorbed into the bloodstream. And once it's absorbed, then the body says, okay, I see there is sugar in here. The body then says, okay, well, no problem. I'm going to release some insulin, which is a hormone that we all of us produce in our pancreas. The insulin helps move that sugar into every single cell of our body. So it's a pretty amazing concept. And why do we want that sugar to be in our cells? Well, we want that because that's the only way we can utilize energy. If it's just hanging around outside the cell, then it's not doing much for us. We're going to feel tired and hungry and hangry, what they call, right? So that sugar, it is so important that every single sugar or glucose, that is the same thing, by the way, sugar, glucose, the same name. That sugar is important that it gets into our cells because it's used as energy. And if we don't need that energy, we store as fat. So it's a pretty efficient system. I mean, all of us, we don't like to have fat, but it's a pretty efficient system where if the energy is needed, if we need to go for a walk or, is there. Now, if you have diabetes, this is what the issue is. Some people may not have enough of that hormone insulin to bring that sugar into the cell, or it can also be that insulin is quite not working well. So it's a little bit not as efficient. So that is something when we talk about what is diabetes and how food is related. Well, food is directly related because one, food does impact how much our blood sugar goes up, but also diabetes, as we know, there may be an issue with insulin where the body is not making enough, or the insulin that is produced is not quite working. Next slide. So what are the symptoms of diabetes? Now, I used to do a lot of education around diabetes, and this is one important thing that you should always remember, every single one of you today. There are symptoms for diabetes. However, remember that some people also don't have any symptoms. And it kind of goes back to what we talk about pre-diabetes. It's so important that we get checked, but we know for sure if somebody's feeling one of these symptoms, it can be directly related to diabetes. But I also know that sometimes people have zero symptoms. Here are the common symptoms: frequent urination, feeling very thirsty, feeling very hungry. Why people feel hungry? Well, because remember that sugar is not getting into the cell, the glucose is not getting into the cell. So the cells are going to be starving. So the body says, hey, look, you need to eat more. Extreme fatigue. People feel very tired. Blurry vision. And the blurry vision, a good way to explain to the patients that I like to explain is, like when you you spill, I guess, some juice in your hands and your hands become very sticky. That's basically what happens to our bloodstream. It becomes very concentrated with sugar and very sticky. And it's important to know that our vision has these little tiny blood vessels, and they become like sticky as well. So the vision becomes very blurry because there's so much sugar in there that it's not, it's quite not working well. So people are going to say, wow, I rub my eyes, I cannot see well. Well, that's just part of having too much sugar. Also, cut, bruises that are not healing well. Well, that has to do with there's too concentration of sugar in the blood, and therefore healing can be compromised. Weight loss. Why people are going to lose weight? I thought that diabetes was of people who were overweight. Well, weight loss has to do with people not getting that sugar into the cell. So people may lose weight. And we see that usually with type 1 diabetes, not so much with type 2. Tingling, pain, numbness in their hands and feet. Also, you may have heard the word neuropathy. This nerves in our blood. Also, the similar thing that happens with a blurry vision. The nerves also get full of sugar and they start damaging them. So that's why people may have that numbness or hands and feet, some pain, nerve pain. That has to do with having too much sugar in the blood. The types of diabetes. Type 1 diabetes, as we talk about, there's many types. Type 1 is when your body has an autoimmune disease. Okay, so what is an autoimmune disease? It's similar to simplify, it's similar to some people have a thyroid problem, right? The thyroid, people don't have enough thyroid hormone. The same thing that happens with type 1. Basically, what happens is that we have these cells in our pancreas called beta cells. And the beta cells, what they do is they make insulin. Well, our body becomes funny where it attacks its own cell. That's why this says autoimmune disease, is because your body is attacking its own cells where we make the insulin, which is called the beta cells. So as you know, as you may imagine, if your body is attacking the cells that is making the insulin, over time, your pancreas are no longer gonna make insulin. The insulin hormone that is so important to bring your sugar down, that allows that sugar to go into every single cell. So this can happen over a few weeks, months, or years. So some people are diagnosed earlier, some people later. What causes? Well, we quite don't know. There's many things that we think that, there's studies looking at vitamin D and they were like, no, it's not vitamin D. Okay, maybe it's the pollution. I don't know. Maybe it's the gut microbiome that is, the probiotics we're having changed in our diet, in our environment, but we quite don't know. We cannot say for sure there's one thing. We also think about virus, how virus can affect hormones. So right now it's just under research, but we know that it's not contagious. It is not because somebody ate too much sugar. It's just that definitely there's something that happens that your body attacks its own cells. type 2 diabetes. So with type 2 diabetes, it's not an autoimmune disease, right? It's what it is, it's the beta cells that make insulin, somehow they decrease. They are not attacked per se. Your body's not attacking, but there's some sort of something funny happening, whether it's inflammation. So usually we talk about the body having too much inflammation, or there's something that it's affecting how our body is efficient in producing insulin, or also how even the insulin that we're making, how efficient it is to work in every single cell. So type 2 diabetes is usually affected in middle age. So that's why we always look at 40 years or older. But again, any age, I think is important that every single one of us get checked. What put us at risk of type 2 diabetes? You know, there is an amazing test that I mentioned earlier, diabetes.org/risk test. But one of the things we know, genetics can be in a way, but also a history of blood sugar, prediabetes, and gestational diabetes. So we know if somebody has had prediabetes or gestational diabetes, not only put the mother at risk, but also the child. Okay, so it's important that we know that. Also, if somebody is overweight or obese, so why? You know, oftentimes research is looking at visceral fat, the type of fat that is between the organs. We know that can be very inflammatory to the body, so that puts you at high risk. Physical inactivity. Right now, everything's so easy, right? We drive through, we put our clothes in the washer. I mean, things are so easy that we end up not using or burning the sugar as much. Therefore, it can kind of put us at risk of type 2. Family history, race, age, high blood pressure, cholesterol, all of those things can put her at higher risk. Now, I do want to mention here, I want to go back and just mention about genetics, because genetics is not saying because your mother had, your father had, is that you're going to have. We know by research right now that your genetics do not define who you are. It has a lot to do with your environment. So what are you eating? How are you moving? That is much more important than your genetics. So it's important that you educate the patients. Look, it's not because your father had, your mom had it, that you're gonna get it. You get the chance to turn this around. So how type 1 and type 2 is diagnosed? Prediabetes. Okay, so we're looking here at A1C. Do you see the first arrow here has A1C? So A1C is an average blood sugar. That's the best way I like to describe to the patient. Is like A1C is an average of your blood sugar in the past 3 months. And they got to give us a history of what has happened in the past 3 months. So if that A1C, which is an average, of blood sugar, if it's higher than 5.5 or 5.5 or higher, I should say, that means that somebody has diabetes. If it is between 5.7 and 6.4, that is prediabetes. And of course, anything below that is normal. Then we also check other things, the fasting, the second error there is fasting plasma glucose. Is when you go to the doctor and they check your fasting when you're fast and the glucose becomes higher than 126, that's diabetes. If it's between 100 and 125, that's prediabetes, and anything below 100 is normal. Also, there's the oral glucose. We don't do that much at all, at least in my experience, we don't do that, but we do use the oral glucose tolerance test when it comes to gestational diabetes. So the diabetes, if your clinic uses that, we diagnose with diabetes if the oral glucose test is above 200, and then pre-diabetes about 140 and around 200, and then anything below 140 is normal. Gestation diabetes. So what is gestation diabetes? Gestation diabetes is, as it says, gestational is when somebody develops diabetes during pregnancy. So this is really interesting because why, right? We know there's many reasons, but here's one thing that I really like that I learned a long time ago. I like the explanation is that having a pregnancy is almost like a stress test for your body. It's like, how hard can your pancreas work at this point? So it's important that to know that some people are just higher risk of diabetes, period. But also there's a lot of hormonal shifts that happens when we are pregnant as women. And that is important that we bring awareness to women that gestational diabetes can happen if we're not as active or don't eat well. One thing important to educate mothers, if they develop gestational diabetes, it can be well managed during pregnancy. Some people require insulin, some people don't require insulin. But here's the thing, by research we know, people who have gestational diabetes, they have a higher risk of developing type 2 diabetes, not only the mother, but also the child. So that's what I like to educate mothers, because it comes together to say, hey, we need to change the eating and physical activity of everybody, not just the mother, not just the child, not those people just affected with gestational diabetes, but also the whole family. It kind of goes back to preventing diabetes, right? Mothers who deliver babies, they will have, most of the time, they would have normal blood sugars after the baby is delivered. Diabetes treatment and what can we do? Let's chat about that. How is diabetes treated? Well, we know that there's many ways, eating, exercise, oral medication, insulin. There's no one size fit at all. We know that medication can be extremely beneficial. There are different injectable medications out there right now, besides insulin. But, it's not just one thing. I always like to tell patients, look, it's about a balance. It's also about what the patient is willing to do. There's not one size fit all. It's important that we realize that. Diabetes, if it's uncontrolled, what is uncontrolled? Uncontrolled is when the A1C, which is our average blood sugar in the past 3 months, when it's above 7. So when it's above 7, we do want to take action. Well, we want to take action starting from pre-diabetes, right? But once somebody has diabetes, we want to make sure that is well managed. Why? Because we know by research, if an A1C is above 7, it will put you at risk of several complications. That includes nerve damage, kidney damage, eye problems, amputation, heart disease, stroke. Now, it's important that we realize that if a diabetes is well managed, well controlled, all this risk will be significantly decreased. So it's not about diabetes, it's about managing diabetes. It's important that people understand the importance of managing those blood sugar so the A1C can reflect to less than 7%. What can you do if you have prediabetes or diabetes? I don't know about you guys, but a lot of my patients over the years, they become very stressed and very worried about once they develop that or they have that. And what I like to do is I always explore with patients and give them good news. Well, at least we know it. Remember, a lot of people, 85% don't even know that they have prediabetes. So the fact that you're sitting down with a patient, acknowledge, hey, good news here. We know you have something, and acknowledge that there's something that can be done about it. That's amazing. That's a win. So bring that good energy and good, reminder to the patient. things as a patient can do. There's things that we can control. There's things we cannot control. But here's one of the things we can do. We know weight loss, even people lose about 5% of their body weight, it can be very beneficial. But here's the thing. When I think about weight loss, I always, think about it's a combination of things, right? Because if we're eating well, if we're doing more physical activity, automatically weight loss is going to show up. So sometimes I like to just focus more on what can we do, because weight loss is going to come. And we know that weight loss is beneficial by studies. Also, as I mentioned, daily activity. We wanted to focus on that daily activity of 150 minutes or less, or more a week. We want to follow a healthy and balanced eating. As you see over here, it doesn't say a perfect eating plan, because perfect sometimes does not exist. So it's about to share with patient, gosh, what can we do here? Can we eat more vegetables? Can we have less carbohydrates? Can we have less processed? Is a balance more healthy, more balanced? It's not perfect, but better balance. I also take medication, and a lot of people are scared of medication. And realize that medication can be extremely beneficial in decreasing their blood sugars. So it's one of the tools that you can have on your toolbox to manage if somebody has prediabetes or diabetes and also prediabetes. Okay, let's see. How are you with time? Let's see here. Okay. What should I know about medications? I would say this. This is the best time in history to have diabetes. Why? Because the medications of diabetes are the most innovative diabetes meds out there compared to 30, 40, 50 years ago. So we have better medication nowadays. So there are oral medication, meaning pills you can take for diabetes. They're not insulin, they're just working different organs of your body. There are also other options of insulin. Remember, people with diabetes sometimes don't have enough insulin, just as you don't have enough thyroid hormone, you take a thyroid medication. The same thing goes with insulin. If you don't have enough insulin in your body, then you do need more insulin. So educating the patient that this is a good thing, that we're giving your body something that your body does not have. There are other injectable medications, which are one of my favorite, I would say. There are classes like GLP-1 medication that help with weight loss and blood sugar management as well. And it's important that you bring it up to the patient, the importance of taking the medication. Again, is one of those tools. It's not just eating healthy, it's not just physical activity, but it's also a combination depending how the patient's the body is working. How does staying active help? This is one of the greatest thing you can share with your patient. Your body, here's how I explain. Your every single muscle of your body is a hoarder for sugar. We store sugar in our liver, but we also store a lot of sugar in our muscles. The minute that you start moving that muscle, the more you are going to require more. You're burning energy. So as a result, when you do physical activity, your body becomes more sensitive to the insulin. Remember, we shared that diabetes sometimes is a disease that the insulin is quite not working, right? Well, by adding physical activity, your body becomes more sensitive, meaning that insulin is going to work better, which is pretty amazing, just by physical activity. Your cells going to take that sugar, again, going to be putting in the cells of your muscles. We're going to be storing sugar in your muscles. So anytime that your muscle needs more sugar, is going to require to come from your bloodstream to the muscle. Also can improve your mood. It's not all about weight loss. It's not all about everything else, but gosh, we are living in a situation right now, a pandemic that is affecting every single one of us. And we have a lot of stress. We know that stress now can raise our blood pressure. It can raise our blood sugar, and also make us not make great decisions when it comes to eating, right? So by being physically active, not only going to improve your sugars, not only going to improve your weight, not only going to improve how your body is using that insulin, but also going to make you happier. It's going to make those hormones, the happy hormones, a little bit more present in your life. What types of physical activities should I do? Any, honestly, but it can be aerobic, strength training, balance training, flexibility, stretching. As I mentioned to you earlier, the requirement is at least 150 minutes a week, okay? Don't go more than 2 days without physical activities. I would say 30 minutes most days, physical activity. Don't go more than 2 days with physical activity. And you don't have to do, by the way, those 30 minutes straight, right? You can you can say, okay, I'm going to do 30 minutes, after my breakfast, 10 minutes after my breakfast, 10 minutes after my lunch, 10 minutes after my dinner. So sometimes when we present to the patient, like, oh, you do need to get 150 minutes, it sounds a little overwhelming, but help break it down. It's like, look, this is just 10 minutes 3 times a day. You can achieve the recommended amount of physical activity if you divide it by 3 times. We also talk about strength training that is important, okay? Strength training is important because you're moving that muscle, you're building that muscle, which helps burn more calories and be more efficient of using insulin. And the recommendations right now is at least twice a week to do some sort of strength training at the gym or lifting weights, things like that. Plan your portions. I love this plate. The American Diabetes Association developed in the past few years, which is the plate method. The plate method is going to be your friend. It's going to be your Bible for pre-diabetes, for diabetes. And I honestly use this plate for people without diabetes because I think they are the perfect plate. As you see, there's 3 parts of this plate. There, you cut the plate in half. The left-hand side, we focus on non-starchy vegetables, which are most vegetables. We're talking about like broccoli and cauliflower and zucchini and salads. Then the other side of the plate, we're thinking about 2 other food groups, which is carbohydrates, which includes the starchy vegetables. As you guys can see right now, you see potatoes there. So that's a vegetable, but it's a starchy vegetable, meaning that starch is going to raise the blood sugar. So it's not about not having starch, it's not having carbohydrates, it's about how much. As you can see, it's not the whole plate, it's not half a plate, it's a quarter of the plate. So when we talk about portions, it's extremely important that you work with the patient about portions. Also here we have protein. Here it can be anything between, we're talking about plant-based proteins, soy, we talk about fish, eggs, beef, other options. Again, not the whole plate, not half a plate, but a quarter of a plate. Of course, we also want to make sure that we include healthy fats because we know by Mediterranean guidelines, Mediterranean diets have been shown to improve our health. So make sure that people are using good oils, olive oils, using good nuts, seeds. Those bring really great antioxidants, but also good fats into our diet. And here is in Spanish. I also use this for my patients who speak Spanish. And I would assume that most of you work with Hispanic patients or other cultures, but realize that you know, in the Spanish culture, Hispanic culture, sometimes there's a lot of tortillas, or sometimes tortillas are used as fork, right? So it's important here that you realize, look, what is going to be your carbohydrates for the meal, and realize, help the patient identify what are carbohydrates. You know, we know that tortilla de maíz is a carbohydrate. So we know that we don't want half of the plate or the whole plate, but we want a balance. We still can have it, but it comes down to how much. The other thing is drink more water. We want to make sure that we stress the importance of not drinking sweetened beverage. Even here, we talk about being careful with, you know, juice in general, because we know that juice also have sugars, whether they're natural or they're added, you know. So focus on drinking more water and leave the carbohydrates to be part of the plate, but not your drink. Next slide. Eat less salt. So here we definitely, we want to focus on less processed foods. You know, processed foods have the highest amount of sodium. And even if you drink a Coca-Cola, you know, that would have sodium in it. Anything that is processed have a significant amount of sodium. So if you decrease that processed foods as much as you can, focus on, even if it's frozen, but it's not added sauces, that can be a great option. Here, again, using herbs, telling the patients instead of salt shakers, you know, using herbs. Also being mindful about, hey, can you try this without, you know, salt? I wonder how it tastes. But, you know, things that we know for sure, pickles or pickle foods can be extreme high in salt, frozen meals. And here's what I come down to salt too, is not only these foods have a lot of salt, but sometimes they have not much nutrition at all. So I also try to understand, it's not sometimes, yes, we're looking at sodium, but it also lacks vitamins, also lacks that fiber, it also lacks other good stuff that is beneficial for our health. So focusing on more fresh, the better. Next slide. We talk about making a SMART goal, right? So some of you may already do this with patients, but being very specific, you know, with patient of, okay, you're gonna walk, okay, so how, when, how are you gonna do it? How are you gonna measure? Is it gonna be 30 minutes a day? Help the patient brainstorm what exactly, how are you going to accomplish that goal? This is a very important thing to help patients accomplish, you know, stay on track, I guess, of their goals. So is doing by SMART goal. If you don't know, if you have never done this, I would encourage you to research. SMART stands for specific, measurable, attainable, realistic, and time specific. And this can be a great way for you to help your patients, your population, to be successful in their goals, achieving their goal around health. Well, that's about it for today for me. Now, Caroline, she's going to talk a little bit about how other resources that are out there for you guys.
Great. Thanks so much, Valeria, for a great overview of Diabetes 101. We wanted to provide additional information and resources because we know that you as community health workers are doing such amazing work in your areas, in your communities. The American Diabetes Association, we do have a professional membership, so you can register to become an ADA community health worker. The cost is only $35 a year, and it does offer additional professional education opportunities like the one that you're listening to today for certificate of completions for the continuing education series. We also offer webinar series on CHW and health disparities focused topics, as well as additional resources. So you can find more information on our website and register at professionaldiabetes.org/ join. Here's some examples of the resources that we provide that you can visit on our website at professionaldiabetes.org/CHW. You can see we do have standards of care. One of the questions that came in asked if you can download the standards of care. You can also access it on your phone with a smartphone. We do have the app. There is a community health workers section where we do highlight CHWs as part of the community clinical care team addressing diabetes care. So we do have resources listed on our website that you can download or find additional information for you to use as far as patient education resources. Just like Valeria has gone over some amazing information, as you are working with any patients or clients in your community and they do want to receive additional information, we do like to refer participants to our education recognition programs. These are our diabetes self-management education and support. So whether an individual is newly diagnosed or they're just in a different path in their diabetes journey or have had some significant life changes and they want to receive additional diabetes education and support from a registered dietitian, from a certified diabetes care and education specialist, you can connect them to one of our local programs. It's at diabetes.org/find-a-program. And I just took a quick screenshot so you can see what this looks like when you visit our website. Where that red arrow is, all you have to do is enter a zip code and you can find a location within a 25-mile radius of the zip code. You can also find a location throughout your entire state. So if you wanted to look up listings of locations in West Virginia and Texas, you can do that, or you can just find a local education recognition program within a certain mile radius within your community. Just like Valeria mentioned, our patient education, our plate method, patient education resources, we do have these available for print. These are great patient education handouts to use, whether you're in person or even to distribute at community events. We've talked to individuals that say that they use this as their guide, and having these easy examples on hand makes it so much easier for individuals to create their plate. We do have these available in the classic version, the top one that you see here, but also in the Southern, Hispanic, Vegetarian, Asian, Indian, and Pacific Islander. So we know that community health workers work with such a diverse community, and we have some great patient education resources available. Additional resources that we have are Ask the Expert series. This is our monthly live Q&A series with individuals like Valeria that are subject matter experts presenting on various topics throughout the year. This is a free resource. We have community health workers that use this as their support group, or they provide it to their participants. You can listen in online, or you can even call in the 1-800 number. So it's a great resource, whether individuals have access to online resources, or if they even have just a landline, they can call in and listen to this. We also have past sessions recorded, so you can even listen to previous session topics. If you're looking to share some healthy recipes, we have our Diabetes Food Hub. These are a great resource to where you have an interactive meal plan, editable shopping list, and especially budget-friendly recipes, because a lot of individuals are asking, what are some budget-friendly, healthy recipes that we can try? So these are new recipes that are developed by our diabetes nutrition and cooking experts. So you can visit this at diabetesfoodhub.org. And you can also download and print the recipes too. For individuals that have type 2 diabetes, whether they're newly diagnosed or they're looking for additional information, we do have our Living with Type 2 resource. This is available in English and Spanish. It's an online resource, but you can also download the resources. So if you want to provide these support resources to your participants, you can download it and print it. But with the online version, you do get monthly e-newsletters, e-booklets, healthy recipes, tips, activities that are upcoming with the ADA. So this is a great resource to share with your participants. And you can help them sign up at diabetes.org/livingwithtype2. And there's also the Spanish version available too. So again, we encourage you to become a member of ADA's Community Health Worker Group. There's lots of great resources in addition to diabetes prevention, diabetes management, diabetes care and support, COVID-19 resources, because we know that you as community health workers are doing such amazing work as frontline workers in your communities. So we do have resources available specific to our professional members. So we encourage you to visit the website and learn more information. So we want to thank you for your time for joining. We're going to go over additional information about the evaluation soon, but if you do have any questions or you'd like to receive additional information about what was discussed on today's session, you can visit diabetes.org or call 1-800-DIABETES. Feel free to reach out if you have any questions or need additional information. And on behalf of the American Diabetes Association, we would like to thank Valeria for presenting today. She was a great presenter, and thank you for your time, and we look forward to connecting with you all again.